On the campaign trail, candidate Trump pledged to not touch Medicaid, Medicare, or Social Security. But this week, according to Axios, he gave Republican senators the green light to scrutinize Medicaid, saying he is now open to cutting, quote, waste, fraud, and abuse. Meanwhile, the administration has been gutting research funded by the National Institutes of Health for weeks. The latest on the chopping block, funding for research into vaccine hesitancy. Let's discuss both of these stories with Dr. Roger Mitchell, president of Howard University Hospital.
Dr. Mitchell, welcome to the table. It's a real pleasure to have you here because the discussion, as we were talking in the last segment about the impact on real Americans out there, the impact that they're going to see. I want to bring up from MedCity News the hidden cost of Medicaid cuts, noting there are hundreds of rural and safety net facilities across the nation that rely heavily on Medicaid reimbursements to cover the cost of care. And for some of these organizations, a significant decline in Medicaid payments will be the straw that breaks the camel's back, forcing them to close their doors. At Ben Finder, the American president of the American vice president of the American Hospital Association Policy, Research and Analytics Strategy. The reality of it is, in both rural Americas, parts of America, and cities like Washington, D.C., where Howard University Hospital is located, these impacts will have a real and devastating impact on the ability of the services you have to provide to poor people. Talk about what that means, what it potentially could look like if these cuts go through.
Well, it looks like decreased care. It looks like decreased access. And that's the issue. Individuals, Medicaid covers individuals that have that are low income, but a lot of people don't understand that it also covers individuals that are elderly. Mm-hmm. You know, individuals like that dual eligibility, if you've ever heard that concept before. Individuals that's poor, but also they also are getting Medicare. Mm-hmm. And so they're using their Medicaid for prescriptions. It's the veteran that's come home that doesn't have insurance but needs Medicaid for their PTSD treatment. Mm-hmm. It's the single mother who is trying to make ends meet, has a child with disabilities, and that child with disability needs Medicaid because they're a child with disabilities, and Medicaid covers children and covers children with disabilities. So we talk about hospitals like mine that are safety net hospitals. They're safety net hospitals that are primarily largely serving Medicaid recipients. Mm-hmm. Medicaid already pays a fraction of what care costs already. It's already underfunded. Right. But then when you decide that you're going to take complete dollars from us, then we have trouble providing the care, not just to Medicaid individuals, but for people with full commercial insurance.
Well, that's it.
We're talking about hospitals shutting down in rural America. And now people with insurance don't have access to hospitals because the hospitals they go to are primarily serving Medicaid recipients.
I mean, it's so important because, again, oftentimes people think of Medicaid and they think of it in a box. Right. That this is just one specific group of people over here, but you've just named five different categories of people that are affected by Medicaid. We talked earlier about the bill and how the bill that was passed takes $1 billion from D.C. because it requires them to return to their funding levels of last year. There was a resolution that Senator Collins and Senator Chris Van Hollen, bipartisan resolution, that would put the funding back to D.C. That resolution passed unanimously, but it goes to the House. The House is not back in session until March 24th. If D.C. loses $1 billion, what does that mean for your hospital?
Well, I think the mayors would make those decisions, and she's indicated that it's going to affect really first responders. It's going to affect how we get our care. A lot of people don't understand that fire and EMS receive Medicaid dollars. How we respond to emergencies in our city, right? I'm a level 1 trauma center. Howard University Hospital is a level 1 trauma center. And we know we have a marathon that's happening in the city right now. We know that there's a lot of activity that happens in the city. Not having a level 1 trauma center in this city is a problem for all that we have to support. And so we want to make sure that we're having an elevated conversation with leaders. you know, as a physician, as a forensic pathologist, and before my role here, I was the chief medical examiner for this city. I've seen failed policy on my autopsy table. I've seen where lack of access leads to death. And so my lens and the lens that we bring at Central Hospitals, Adventist Healthcare, Howard University Hospital, we bring this lens to say, hey, listen, let's really understand exactly what we're doing here. Because I don't think people really want to gut and make sure that people don't have health care. And fundamentally, I feel like we need a strong work. If all the workforce is coming back to the United States of America, then we need a strong and healthy workforce. It's actually an issue of national security, if you ask me. A sick community, a sick populace can't even defend its own borders. So if we're really talking about and elevating this conversation about healthcare delivery, we need to elevate it to all aspects.
If we did not learn that after a pandemic, I wonder what it would take for us to learn it.
Preach it now, Alicia.
The cuts to Medicaid were not the only healthcare story we saw this week. You have HHS Secretary Robert F. Kennedy Jr. sort of poo-pooing vaccines when it comes to measles. You have Trump's DEI order, which could upend hospitals like yours, the workforces in them. I wonder, given all the incoming you have, what you see as the biggest threat right now to America's health.
Well, I think you've laid it out, right? So if there is a notion that we are not going to ensure that everybody has access and continuity of care, right? If that is and then we're going to put ourselves in position where we're not leading in research. The United States of America, we lead in research.
No, our vaccines will come from China.
The thing about it is that even if they come from China, if we don't understand that vaccines are important to our health care, then in our community may not even take the vaccines that are coming, right? And my daughter's here, right? And we got her vaccinated for HPV, right? That's human papillomavirus. And because we know that there are particular viruses that lead to cancer, and so we get individuals vaccinated to prevent cancer. There's so many benefits to vaccination. It's not just the measles vaccination, and that's important, but there's vaccinations that help us deal with future diseases. And so we have to elevate science, we have to elevate innovation, and we have to have a conversation that is real about this, not what we think it should be, but what it really is.
Is there, I mean, I know we have to go, but is there a concern, given all the conversations happening with DEI, and I'm using quotes because what are they really talking about, that the policies out of this administration, the executive orders, could have an adverse effect on HBCUs, particularly hospitals like yours, or I'm thinking of Meharry Medical College, and the recruitment of black doctors and nurses and medical professionals?
Well, Howard University produces the majority of black physicians in this country, whether it's its med school, whether it's through its residency. Race and racism is always a part of the discussion, right? We're in America, it's always part of the discussion. The issue here is that this is not just racism. This is cutting into people that are poor. And it's not just black people that are poor. It's not just Latino people that are poor. This is really fundamentally going beyond racism into our entire lifeline here in the United States. And so we want to have this conversation. Howard University, we've always led in these areas. So we want to have these conversations and educate policymakers. That's why it was important for me to come today, so that we could educate the community. And let's have a sober conversation about this so that everybody knows what's at stake.
Well, I think that last point is the important one, that, it's not the black community or the Hispanic community, it's every community, which is why you're seeing folks show up at town hall meetings who look very white, by the way.
Every community.
Every community. That's
Dr.
right.
Roger Mitchell, we appreciate you so much. Thank you for being here.
Thank you for having me.
Thank you. Speaking